to the lobby floor. She survives the fall with multiple fractures, but the paralysis below the waist remains permanent and unexplained. House analyzes her deteriorating vitals and a recurring B12 deficiency. He realizes that, despite receiving high-dose supplements, her B12 levels are not rising. He concludes that a thief is living inside her digestive tract, intercepting the nutrients before her body can absorb them. House hijacks an occupied operating room and forces the current surgical team to leave. He bypasses standard preparation and orders an immediate abdominal incision. Because Hannah's lower body is already numb from the neurological damage, he begins the procedure without waiting for full anesthesia. House reaches into her small intestine and grasps a pale, flat object. He begins to pull. He hauls a massive ribbon-like creature out of her body, coiling it like a heavy rope as it emerges inch by inch. The broadfish tapeworm eventually measures 25 feet long. This parasite had been draining Hannah's essential vitamins for months, triggering the systemic failure that led to her hallucinations and her sudden paralysis. With the organism finally removed, the biological cause of her mental and physical collapse is eliminated. House documents the specimen and exits the theater. Dr. Gregory House observes 16-year-old Hannah in the emergency room. She is soaked from the snow but does not shiver. He notes the scars on her lips and tongue, marks left from chewing on her own flesh as an infant. He identifies the condition as SEPA, a rare congenital insensitivity to pain. House, who lives with chronic leg agony, faces the girl with cold envy. He suggests her life is a luxury of pleasure. Hannah corrects him. She describes a life of mechanical maintenance, checking her corneas for scratches every morning and setting watch alarms to urinate so her bladder does not rupture. To test for a spinal tumor, House orders a biopsy of a cranial nerve. He secures Hannah's head into a rigid metal frame and attaches an EEG to monitor neural discharge. He refuses the use of anesthesia. House stands inches away as the surgeon activates a high-speed surgical drill. He intends to drill directly into her skull to see if her brain registers the intrusion. The drill whirs near her eyes. Hannah feels no physical sting, but her vitals begin to destabilize from the sheer stress of the observation. As the drill bites into the bone, the heart rate monitor triggers an alarm. Her pulse fluctuates violently before her system shuts down. She loses consciousness and slumps in the frame. House ignores her face, staring only at the monitor to see if the girl who cannot feel finally produced a signal. Cameron approaches House in a darkened lab. She initiates a lingering kiss, appearing to offer a final goodbye. As they break apart, she reaches into his pocket and secures a stolen syringe of his blood. She is determined to find a way to save him from a terminal diagnosis. The medical team analyzes the sample alongside brain scans showing a 6-centimeter mass in the midbrain. They conclude the tumor is inoperable. Wilson meets House later, attempting to offer emotional support to a man he believes is dying. The tension breaks when the team runs an FTA-ABS test. They discover the mass isn't cancer, but a treatable infection. They rush to House's home with the news, expecting relief. House meets them with cold anger. He reveals the entire diagnosis was a fabrication. He stole the records of a patient named Luke to create a fake medical history. He didn't want a cure. He wanted access to a restricted clinical trial in Boston. House intended to have surgeons implant electrodes directly into the pleasure center of his brain to stimulate his dopamine receptors. He faked a death sentence just to achieve a neurological high. He mocks the team for saving him and ruining his trip. Wilson stands in the doorway, realizing the depth of House's isolation. House would rather undergo unnecessary brain surgery than spend a normal evening with a friend. He chooses a needle in the skull over a simple pizza. The doctors leave, realizing their grief was nothing more than a tool for House's latest addiction. Patrick Abikuff is a piano savant who cannot perform the simplest tasks of daily life. At a high-stakes concert, his hands lock in mid-performance. He collapses in front of a stunned audience. Dr. House takes the case and orders a functional MRI. He instructs Patrick to pretend his leg is a keyboard. As Patrick's fingers tap against his side, the monitors reveal a stark reality. The right hemisphere of his brain is not processing music, it is dead weight. It serves only as a source for the electrical storms causing Patrick's terminal seizures. House presents the father with a brutal ultimatum. He can keep his son as a musical monkey for the world to admire, or he can authorize a hemispherectomy. Removing half the brain will end the musical talent forever. The father hesitates, clinging to the prestige of his son's genius. House strips away the sentiment, calling the piano skills a mere neurological accident. He tells the father that loving a gift is not the same as loving a son. He offers a future where Patrick might only be capable of flipping burgers, but he will finally possess his own life. The father eventually consents to the surgery. The right side of Patrick's brain is cut out. In the recovery room, Patrick sits up in bed. He is no longer a world-class musician. He looks down at his hospital gown. His fingers, once capable of impossible concertos, now focus on a single plastic button. He aligns the fabric and pushes the button through the hole. For the first time in 25 years, he has dressed himself. The genius has died so the man can begin to live. Dr. Cuddy forces House to accept the case of a veteran suffering from unexplained fatigue and joint pain. The VA hospital has already dismissed these symptoms as psychosomatic, labeling them a fake Gulf War syndrome. House ignores the medical charts and uses the LexisNexis database to investigate the man's financial and personal background. He identifies a pattern that the previous doctors missed. The veteran's condition rapidly escalates. Initial brain scans reveal 6 distinct tumors, but when the team prepares for surgery, a second scan shows the tumors have vanished. The medical team faces a total contradiction. The patient's health collapses further. He loses his hearing and suffers complete paralysis of his lower limbs. While his team reaches a dead end, House examines the patient's face. He notices the man has no nose hairs and carries faint cauterization scars inside his nostrils. House links these physical marks to a history of chronic nosebleeds found in the patient's family records. He concludes that the vanishing masses were not tumors, but arteriovenous malformations that expand and contract. This confirms the diagnosis of hereditary hemorrhagic telangiectasia, a rare genetic disorder. The supposed psychological syndrome was actually a lethal vascular defect. House orders immediate surgery to repair the malformations. The patient survives, and the VA's misdiagnosis is exposed as a failure to look at the physical evidence. House resolves the case by prioritizing hard data over medical assumptions. Chase and Cameron sit in the darkened sleep lab, staring at a patient's brainwaves on glowing monitors. Chase breaks the silence. He gestures toward the empty hospital beds in the adjacent rooms and suggests they take advantage of the privacy. Cameron points out the security cameras, but Chase is undeterred. They turn off the recording equipment and disappear into a vacant room. While they are gone, the patient's condition destabilizes. Foreman arrives at the station to find it empty. Later, in the diagnostic office, Foreman confronts them. He demands to know their location. At the exact moment the patient woke up, Chase claims they stepped out to grab coffee to stay awake. Foreman does not buy it. He notes they were empty-handed when they returned. The lie collapses. Cameron admits they were having sex in the sleep lab instead of monitoring the patient. She offers a blunt apology and tries to pivot back to the medical files. Foreman is not finished. He mocks the pairing, suggesting Cameron is merely using Chase to distract herself from her fixation on Dr. House. He insults Chase by implying he is her last resort. Cameron snaps back, insisting her feelings for House are dead, and this arrangement is strictly physical. She demands they return to work, but the professional trust is shattered. Chase remains silent, the weight of the humiliation settling in. The room is no longer a place of medicine, but a battlefield of damaged egos and exposed secrets. Chase and Cameron enter a patient's home to search for environmental toxins. They ignore the medical evidence and move to the bedroom. They have sex in the house of a woman currently fighting for her life. Back at the hospital, Foreman observes a dangerous change in their professional dynamic. They have stopped challenging each other's theories. Foreman confronts them directly, stating that their sexual relationship is compromising their clinical objectivity. He argues that they are now prioritizing personal harmony over the patient's safety. The situation turns critical when the patient's brain begins to fail due to rising intracranial pressure. The team must choose between a lumbar puncture to test fluid or drilling a burr hole to relieve the pressure. A lumbar puncture is faster but carries a lethal risk. If the pressure is too high, the brain will herniate, causing instant death. Seeking to avoid a professional disagreement, Chase and Cameron align on the safer consensus-based path. They choose the lumbar puncture. The patient nearly dies during the procedure. The medical error is a direct result of their refusal to disagree. Their need for a smooth relationship nearly created a corpse. Cameron realizes the weight of their bias. In the aftermath, she confronts Chase in the hallway. She admits that Foreman was right. Their judgment is no